today about sphincter of Oddi dysfunction. Now, what makes me talk about this is that this is not a very common topic that most of the people talk about, but I find it very interesting. So, let me give you a few insights into this topic. Okay, the sphincter of Oddi dysfunction can be of two types. It can be a biliary type and a pancreatic type. Now, before knowing about the dysfunctions, you have to know what is a sphincter of Oddi. Initially, I assumed you must be knowing that, but if you don't know that, then let me tell you that sphincter of Oddi basically is a sphincter mechanism that controls the common channel of the pancreatic and the biliary flow. Okay, it's about 6 mm and has a complex structure. There is a common sphincter and a superior inferior colodocal sphincter and a pancreatic sphincter. This is sphincter of Oddi that controls the flow of both pancreas and biliary enzymes into the duodenum. Now, what happens when it does not function properly? When there is biliary type of dysfunction, you get mostly biliary type of pain. That means pain confined to the right upper quadrant mostly. Raise in LFT enzymes and dilation of the CBD. Apart from this, you will also get on investigating, there's a delay in transit time of the bile juice. Which you will generally find it on HEDA scan. If you do a HEDA scan, you can demonstrate that. However, the gold standard to diagnose a biliary type of sphincter of Oddi dysfunction is ERCP with manometry. The cutoff value here is 40 mmHg in the manometry, right? Now let's talk about the pancreatic type of SOD. Pancreatic type of SOD. Here you get recurrent pains. Mostly it presents as recurrent acute pancreatitis, and therefore in cases that present with recurrent acute pancreatitis and no definite cause can be ascertained, they must be investigated for this, right? Now, both the biliary and the pancreatic type are further divided into three types: type 1, type 2, and type 3. Now, type 1 is where you get the pain and dysfunction of the LFTs and dilation of the duct, also some biliary duct in biliary type of SOD dysfunction, and dilation of pancreatic duct in pancreatic type of dysfunction. Type 2, you get pain plus one or two of the above criteria, and in type 3, pain is the predominant feature and no other symptoms. So the one that will benefit most from any intervention will be type 1. Okay, so the one who will benefit most is type 1. What do you do? How do you treat? So now we should have a look. I have given you a brief idea of how it presents and what are the dysfunctions that you can investigate, like the derangement of LFTs, dilation of ducts, and delay in transit time of the bile. Apart from that, now just a short info about how can we treat sphincter of Oddi dysfunction. Right? So treatment. Now, the one that benefits most with treatment is the type 1 type, and best is you can do a sphincterotomy by ERCP, right? And in extreme cases, when sphincterotomy, even the symptoms are not relieved by sphincterotomy, you may have to do a sphincteroplasty, transduodenal sphincteroplasty. Or sometimes even resection of head of the pancreas has to be done. If the head is very much scarred or damaged. right? But all this in type 1. Type 2 and type 3 have not benefited much from any interventions, and decision to take an intervention has to be guided by manometry in most of the cases. And also, in some of them, we can do a stenting of the pancreatic duct, or you can give botulinum toxin injection. However, these are not long lasting methods, but if the patient benefits from these, you can of course go for a surgical intervention. Okay, so yes, and apart from if you cannot do surgical intervention, or in type 2 and type 3, you may also when you have to control it by medical treatment, you can try PPIs, spasmolytic drugs, and sometimes CCBs have been tried. So these can be tried to provide some relief. Yeah, so that's about SOD dysfunction. Now, main thing is post cholecystectomy syndrome. Some people, even after having cholecystectomy, present with similar type of pain, I mean the right upper quadrant pain. So in such cases, SOD dysfunction must be investigated for. Similarly, I have also said earlier, recurrent pancreatitis in which cause cannot be ascertained. This can be a cause and this should be investigated. That's all. I guess that much is enough for today's video, right?